I would like to welcome our viewers to today's AMII program. Today we're at the AMII studio located at the Orange County training facility that AMII has here in Fullerton, California. At the Academy of Minimally Invasive Implantology, we like to bring these programs so that doctors who are looking to possibly incorporate the use of implants into their practice, or who may be already placing implants in their practice, can be exposed to some of these new ideas, which I think allows them to offer their patients the very, very best. So I welcome you all here. We're a small community of like-minded individuals, and so welcome to this community. One of the purposes of us doing these programs is it gives you a chance to meet some of our educators, instructors, and just some of the users of the implants and using the AMII approach. And what I find is their stories are always very unique, but we find that in many, many ways we're all very much alike. And each of these interviews that I do, I am inspired by those that speak, because there's so many different ideas that we're exposed to. And when I go back to work the following day, I am more inspired. So I really appreciate our guests for coming out. Today, well, let me do one more thing, because we want these programs, again, to be very relaxed. Today's going to be very conversational. So if you can, go out and grab a cup of coffee or just get a drink and just sit back and listen to our presentation, which today we're very honored to have Dr. Elsherif, who's here, who a very accomplished clinician. So I'm very excited to learn from him, and we have a lot of things in common, such as our kids coming to our practices, so we can talk about that a little bit. So Dr. Elsherif, thank you very much for joining us.
Thank you, sir. I'm happy and honored to be here.
Yeah, it's a pleasure. So let's start off from the very beginning. You, again, aren't from, well, we weren't born in the U.S., so give us a little bit of a background. It's interesting, your international perspective.
Yes, I was born in Cairo, Egypt, and since I was young, I have the passion, because all the kids, when they go to the dentist, they are afraid. Mm-hmm. When I was young, I was one of the kids who, when you go to the dental office, I was very happy to see the tools and the instruments and the lights and all the stuff. So this attracted my my thoughts, and I began thinking, oh, you know what? When I grow, I need to be a dentist.
Wow.
And who discovered this? Imagine my late mother.
Really?
So she told me, you know what? I think if you grow and be a dentist in the future, I think you'll be very successful, because you are passionate about that. Mm-hmm. So the seed was built in since I was young.
So how old were you about then?
I was in the age of, let's say, 4, 5, 6. And when I was kid, I used to go to a dentist who was a friend to my late father. And he was graduated from Edinburgh in England. And he was a very classical old dentist. Mm-hmm. But I used to like the way, and he was a very good man in handling his patients. Mm-hmm. So I got the impression, you know what? I need to be like this guy when I grow up. Mm-hmm. So dentistry is a passion for me. Wow. And I went from high school directly to the university, and I graduated as a dentist when I was 21 years and a half or something, like less than 22 years old. Mm-hmm. Wow. And this was my passion all my life, to be a dentist. Mm-hmm. And I graduated from Cairo University, the dental school there. And I began my career, and I took my master's degree in endodontics, and then PhD in restorative. Mm-hmm. And then I practiced there in Egypt for about, let's say, almost 18 years or something like that.
18 years?
18, yeah.
Wow.
18 okay. Something.
Yeah.
And then I shifted here to California. I took my California license in 2000, and I'm practicing here in California since 2000. Mm. And all my life I was teaching. And even when I came here, I got my license. I began teaching in Loma Dental School, in the endo department, and very good guys there. And I like the school, and I like to teach all the time, because it's part of the passion in life. is to increase your skill and increase your knowledge, and then to share what you have with other colleagues and the new generations. I'm trying my best to do that. And I like to share my knowledge, if you can say I have some knowledge, I think.
Yeah.
And then that's the way how dentistry improves, is that to improve your skills and to share all the stuff. And sometimes sharing, you get benefit by giving what you have, and also you are correcting yourself and getting new ideas by this sharing.
Absolutely.
So I'm doing my best always.
Well, I think one of the great things about the education is that you're able to inspire the young dentists while they're still in school. So let me ask you, when you're, you mentioned that you were at Loma Linda on Fridays most of the time?
Yes,
Friday?
every Friday I teach.
And that's in the endodontic department?
In the endodontic department, I supervise and teach in the clinic for the graduates and undergraduates.
Okay, yeah.
So always I'm there every Friday.
Okay, and in your, let's step back, so you have a private practice also. You're doing everything.
I have a private practice, yes.
And in your private practice, you're doing general dentistry?
Yes, in general, I do general dentistry, cosmetics, and implants. I do a lot of implants.
You do everything, yeah, okay. And then to kind of fill in your picture, we were talking about the similarities. Is it your wife is a dental hygienist? Does she work in your practice?
Yes.
Or, yeah, okay.
My wife is a hygienist, and she's working with me in the office. And my son, he took his California license. He graduated from the dental school. From Oklahoma Dental School, and he took the California license from 2.5 months ago, and he jumped in the boat with me, and he's practicing with me.
Yeah, that's great.
Yeah, it's good.
Yeah,
it's good.
Yeah, it's so nice to have one of the kids to be able to be there with you.
Yeah.
And, you know, we talk about teaching, and teaching, like you're right. You know, you give a little bit when you teach, but you get a lot more back.
Of course.
And when you're able to inspire, you know, our colleagues, that's rewarding. But when that colleague is your child, that's an amazing thing. So that's great.
That's very good. And yes, teaching is very important so that we will be psychologically balanced. Because if you are improving yourself and your skills all the time, you need to get it out so that everybody will share everything. And really, I tried it all my life. It balances me psychologically, because the private office is a lot of stress. It's a business indirectly, overheads and business. So when you teach, you are sharing and you are out of this battle of the business. So you share and you meet the new generation, and you feel the power of the youth, you know, and the inspiration. So you share together, and you are getting a booster emotions, and you need to get yourself kick in to that. I like teaching and like to share, and I get benefit more than my students even by having all this emotions and sharing. And sometimes, trust me, sometimes of the new generations, some of them are very intelligent, and some of them, they will tell you a word or something. It can be a beginning of a lot of thoughts in your mind. No, that's why business and our profession get improved by this, by talking to each other as friends, as professors and colleagues. So everything gets on the right track. And the business and the profession improves in this way.
No, I agree. I mean, it's, you know, there's certain topics that it seems like there's polarized entities on certain topics, but you know, I sit there and I think you're absolutely right. You know, it's better if we don't polarize thoughts and if we come together, because there's a lot of commonality. No matter where you are, like, having had, like yourself, being able to teach all over the world, you learn that dentists, we all have the same problems, the same challenges, and so there's a lot of commonality.
For sure.
I think we could solve world peace, you and I.
I hope so.
Well, let's go back to the your practice. So you've got the family working there. Is it a large practice? Is it a small practice? What can you share with us about how your practice runs?
Our practice is a medium-sized practice. We have 6 units functioning and X-ray area. We have a cone beam. We have up-to-date instrumentation. We have CEREC. We have We have peso drills. We have a lot of stuff in our office. And I'm a handyman. I like to have tools in my office. Even if I don't use them on daily basis, but I like to have the tools beside me. Sometimes if you need them, it worth millions. So we are trying to improve all the time, and we can deal with any problems, even big problems, we can deal with it. Of course, we don't overestimate ourselves, but we know our limits, and we are practicing and doing very good dentistry within our limits. So we are a moderate or medium-sized office, and but we are updated in everything.
Well, your son's lucky that you have all the toys there, right? He's not going to have to buy that. He can just use it.
No, the dad paid the bill.
Dad paid the bill. On both sides, the education and the office, huh?
Oh, yeah.
Well, that's great. So, you know, you shared the inspiration for you to get into dentistry was the dentist that you knew and the way that he handled patients and everything like that.
Yeah.
And then, so it seems like once you graduated from dental school, you got your advanced degrees in endodontics, and that was kind of a passion of yours. Now, tell me a little bit about implantology, because you're gaining skills in all these different areas. How do you see that fitting together? You were telling me that you saw the evolution in endodontics, where we were extracting teeth instead of saving them with endo, and now that maybe we have a tooth that can't be saved with endodontics, and now we've got the next storm coming with the implants. So give us some of your insights.
Yes, I'm in the generation where I lived with the endodontic era. It was a big revolution, a big tsunami. At this age, in the 80s, I remember, we were the endo guys and we are the conservative guys. We are the guy respecting the teeth and the tissues. And at this age or in this era, some people, they extracted teeth which has minor fillings or cavity. They don't believe in endo, they don't believe in all the stuff. So we began dealing with them as if, you know what, if you don't do endo, you're out of date. You need to be updated. So nowadays, you know, endo is an established science. Everybody's doing it, and it's a fact now. So I lived this era, and now we are living in the second era, which is a big tsunami, which is the implant. Nowadays, there is still people resisting the change or resisting the future. Implants is an established science now, no arguing, and it is part of dentistry. So don't resist the change. Now in the future, in the near future, if you don't do implants, you'll be out of date, like the era from 30 years ago of the endo and the root canals. And now everything is established. Endo is a proved science, no argue about it. But now the implants, it's going into this route. If you don't do implants now or in the coming several years, you'll be out of date. Don't resist the change. You need to cope with the advancement and the technology. Implants now is established. It's a very successful procedure. I'm not saying that the other parts of dentistry is minimized, no way. But implant is part of dentistry now. So you need to be updated and you need to do it. So this is the second tsunami we are living in.
Yeah, I think you said that very well and very passionately.
Yeah.
That's great, yeah. So in keeping with that, we were talking about, you've been placing implants for quite a long time.
Yeah.
You know, can you share with us how that learning curve has gone for you in implants? Because you probably have used different systems over the years.
Yes.
And then maybe how it has changed the lives of, well, you and your practice and that of your patients. So why don't we start off with talking about some of the systems that you've kind of gone through over the last 20 plus years of doing implants?
I have passed by several systems, and the learning curve, I passed it sometimes the hard way and the good way also at the same time. There is a lot of systems, a lot, you can't count them.
Yeah.
But I already have practiced, let's say, 6 or 7 systems in my life. beginning with the established ones like Brunner Mark and Nobel Biocare and Implant Direct and AB system and IBS system. I'm practicing this IBS from several years and doing a lot of cases with them. And this new system of the minimally invasive dentistry with the core and all this magic core. So in the learning curve in implant dentistry, you need to have basics of surgery, because this is a simple but a very unique type of surgery. I'm not saying it's a complicated surgery, no. You need to have steps to know it, to respect the tissue, to respect your incision, respect the bone, control the heat generation, the material of the implant. If you do a good surgery by having these principles, you're getting a big chance of success. Like the heat generation and control, the incision, the clean cut incisions, all this. This is ABC of surgery. If you apply this, most probably you will succeed. The implant material, which is nickel, titanium, and all this stuff, is a bone-loving materials. So don't go by the advertisement only, no. Because if you have basic principles of surgery in your application, and you use a reasonable or any implant, you will succeed. So in general, the learning curve, you need to know the basics of surgery, how to respect and be conservative with the tissues, respect the human tissues. I remember my professors used to tell me this. You need to respect the human tissues. The human tissues in general, the gums, the bone, the periodontium, you need to respect them. And to be very conservative in your approach, least traumatic problems during the procedures, so that you'll have better chance of healing and giving the body a better chance of coping with the trauma of the surgery. So I pass by a lot of these. In general, I have my own agenda and protocol which I follow. The most important thing is to respect the tissues and don't play the role of the hero. If you don't know anything, chat with your colleagues, chat with elderly, with old dentists. Begin share with them. Tell don't be shy. You need to share. You need to talk together. Tell them what's the problem. How can we overcome it? What do you think, doctor, from this? And trust me, you will gain a lot by chatting with elderly dentists or dentists, even if not old or elderly, having experience more than you. It's a win-win game. So that's the main thing I want to tell to everybody who's doing this system or want to begin approaching the implant procedures, or begin to, he is attracted to the minimally invasive procedure like AMII.
AMII, yeah, AMII, yeah.
I think you need to share and begin put your thoughts, and don't be shy to ask. That's the way to begin the work. But if you begin from the beginning having your own agenda and own protocol, it doesn't work like that. We need to share and ask elderly about their experience, and trust me, you will gain a lot.
No, I agree with that. I think that's great advice. So we talked about AMII, AMII is the Academy for Minimally Invasive Implantology, but the minimally invasive concept, which you've now learned compared to conventional implant placement,
Yes.
do you see advantages to not now laying a flap and now creating a conservative osteotomy and being gentle to the bone, as you're mentioning, to respect it by threading the bone so we don't stress the bone or crush the bone with either our drills or the placement of the implant? Do you see advantages to the biology of the body in doing it that way?
No arguing. If you are minimally invasing the tissue and minimum trauma to the tissue, you're giving a chance to the body to heal and cope better. So when you raise a flap, it's a trauma. When you reflect a flap, it's a bigger trauma. When you drill, it's a trauma. So if you can minimize all these traumas in your work, so you're giving a body a better chance of healing because you are minimizing the insult to the tissue, and it will heal faster for sure. So this techniques, I think it has a good future.
Yeah. What do you think of the, because again, going back to tissue, that, you know, we talked about the bone, but now the tissue having a single body implant, right? So we place everything into the bone and we pass through the tissue all at the same time, and then we allow that to heal around our magic cuff. Do you see the principles of that being advantageous too?
Of course,
Yeah.
very advantageous because it's less trauma.
Yeah.
You're just drilling or making a small punch to go inside, and then you're placing the whole implant with the body, with the neck and the collar, so it is seated on the gums, and you're giving a body a chance to heal and cope and bind together. So it's a minimum trauma. It's a single step, because sometimes opening a second surgery to expose the implant and put a healing collar, this is another trauma. But if you put it from the beginning, one single non-traumatic, non-invasive placement, and let the body heal together, after that the prosthetic part, you're dealing with the top part which is already exposed. So you don't make a second trauma for a second surgery. It will heal faster for sure. I think this technique will be good for a lot of stuff.
Yeah. It fits really well in everything you're saying. I mean, as far as respecting the hard tissue, the soft tissue, you know, the crown, the restoration we're going to put on the top, this system is so well thought out by Dr. Wong that all three of those are placed in one implant body with a different placement technique as you've learned. So it's really a unique way of placing implants, which I hope is the way implant surgeries go in the future. It just seems like it makes so much sense, you know, when you talk about it. So
it is logic, and it is very logic, and dentists who begin playing with these tools a bit at the beginning, they will get it.
Yeah.
Because any clinician, when you begin talking to him in a logic way, he will get it.
Yeah.
And it's a less trauma. You're minimizing the second surgery, getting it out. And even the first surgery of the placement, minimum trauma.
Yeah.
So the body heals faster and copes directly.
Yeah.
Oh yeah.
So what do you see as far as placing implants? You know, you've got a young dentist, your son that just joined the practice. I'm interested because you're involved with the, you know, the dental school level. What is your picture 20 years out? What do you think endodontics is going to look like? What do you think implantology is going to look like? Do you have any vision of that in the future?
There is established parts of dentistry. Endodontics is an established science. But sometimes in the retreatments and all this for the second time and third time, sometimes it is questionable. In the old days, we used to do this surgeries and all this stuff because this was the only alternative you have in our hands. But endo will not be affected because if you have an exposure or an infection, you need to control the endo root canal. But in some cases, a retreatment for the second time or the third time, sometimes it's questionable, and it's a lot of money. And whenever we go to the second and third time of retreatment, I don't know, this is questionable and a lot of money. We can't guarantee our work. Because there is the implants, which is already an established science now, we can go for it. But as regards that the implant will affect the endodontic as a specialty, I doubt. Endodontics is established science. But maybe it will affect the retreatment procedures for the second and third time. This might be minimized a bit because this is a lot of money, a lot of stress, and sometimes the results are borderline or questionable. This might be affected. But endo is established, no arguing, it will not be affected. But this multiple retreatment surgeries and all the stuff, this might be questionable in the future. I think so, but I am telling this from my experience. But we don't know how this will work. What I'm understanding and I'm sure of is that I do a lot of root canals and I do a lot of implants. These are different choices in the hands of the dentist. And whenever the patient is paying a lot of money in the retreatment, all stuff, you know what? You need to give him the offer. You know what? we paid a lot of money in this, Mrs. X or whatever, and this is unfair. I think if we can try this, this will be a better, durable, I think this will be worthy. And also we need to be fair, because if this patient is your brother, will you let him to go and do all this stress and all this surgery, and you are not 80 or 70% sure that it will succeed? This is unfair.
Yeah.
That's what I think.
No, it's great. No, I love, like you said, you know, being able to ask a colleague a question just to get their opinion. I don't think there's a right or wrong. I'm asking you to look at a crystal ball, so who knows? So with the implants and the endo, you know, they do tie well together. We do the best we can to save a tooth, and if we just can't save the tooth, then, like you're saying, instead of trying to rework this over and over and over, maybe we're better off just going into the implant and just kind of resolving that. So it's a great service to offer our patients. With your son, how is he going to place his implant soon?
He is assisting me already.
Okay.
And I think in several months I will begin giving to him simple cases, but he's shadowing me.
Yeah.
And he's like a sponge. He's taking everything.
Soaking it all up.
I think he will make it.
Yeah.
He'll be a good. I think so.
Well,
He'll be fine.
That's great. He's very fortunate to have you as a mentor, a father. Somebody sets the bar for him to what, you know, the level of his performance and what to expect. And I think he's lucky. It's, you know, so we both have children that joined our practices in the last 2.5 months, and just kind of a side question is, I know a lot of the kids that graduate today, they end up having to go to DSOs and things like that, you know, corporate type of practices. So I think our kids are lucky to be able to be eased into dentistry, not kind of expected to perform quick types of dentistry. So hopefully they get a good base. Not to say the DSOs are not doing that, but you know, typically they're going to be a busier type of practice. And in our practices, I think I'm like you. I'm letting my daughter kind of ease into it and take her time.
Take her time and change gears gently, step by step. They will get it. We don't want now at this time. It's the learning curve. It's not money for them.
No.
Even if they are not productive enough, no problem. Let them take their time, change gears gently. I want their brain and their knowledge to be on the peak, and then after that, everything will come by time.
Yeah. So I love that you're a passionate man and an educator that wants to share. What do you see as your future? You're going to go another 30 years?
For me?
Yeah.
I hope so, but I doubt that 30 years more, but I don't like to retire.
Yeah.
I like to work.
Yeah.
Maybe when my son takes over a bit more, I will teach more days, maybe.
Okay.
But completely retiring, I don't think about it now.
Okay.
I don't want it now. I need to work.
Yeah, no, that's good. I mean, I'm the same way. I have patients, they go, well, you know, you've been working for over 30 years. When are you going to retire? I tell my patients I've got 27 more years to go.
Yes.
And so they laugh at me. They go, why 27 more years? So my story on that is my father practiced for 58 years, and I want to go 60. So I've got
you need to break the record.
26 more years to go, you know, hopefully our bodies will allow us to make it.
Hope so.
And maybe all I'll do is I'll just place implants. That's what we're rewarding. I know a question I wanted to ask you. So if you had a tooth, let's say it's tooth number 14, and you had an opportunity to either place or do a root canal on tooth number 14 or place an implant, which do you think is harder?
For me, endo is very simple. You're talking, to correct the question or to be sure of the question. Is it a sound tooth, just doesn't have any root canal before, or a retreatment, or was this
First time.
First time, I'll try to save the tooth if it is periodontally intact, and if it is just invasion by decay to the chamber, and I will first of all try to save the tooth. The problem is that if there is infection after, let's say, several years, and there is a lesion in the mesiobuccal root or whatever, and there is infection, at this time, I will evaluate the periodontal condition and all the stuff and the incidence of cracking or whatever, and then re-evaluate. Is it worthy to retreat it, or it is more feasible to get rid of it and put an implant?
How about doing the actual procedure? If you had a choice of doing a root canal and you had a situation where you could not do the root canal, but you had to remove the tooth and place an implant, would doing the root canal be easier for you? Just the procedure itself?
No, the procedure, any dentist, when he's trained on any system, he will make it.
Yeah.
But the idea is the choice. Which route are you going to choose?
Yeah.
Always, I like to respect the tissue. I'm a very conservative guy in my work. So my first choice is to save the tooth. If it is periodontally good, no pocket depths, no cracking, nothing, I try to save it by root canal. If I fail, I have my choice because I'm an expert in placing implants. I would do to the implant. Also, we need to give the offer to all the patient also. This is from the liability and legality, and to give the advice. But if the patient, you tell me, you know what, I'm tired of this pain, I need, okay, you need to explain as a dentist all the choices of the patient to the patient. And then give, if he asks my advice, I'll tell him my advice. And then he push the button. But in general, I like to save the natural tooth at the beginning if it is savable. If it is not savable, for sure, get rid of it and put an implant.
Oh, no, that's very good. Yeah, you know, I think placing these implants these days, for me, I think if I had a choice, if we had an area that we could do a root canal, we'd want to try to save it first. But if I was comparing the two procedures, either doing a root canal on a molar or placing an implant in a molar site, I think placing an implant in the molar site is actually an easier procedure. So
in general, placing an implant is, from the time factor, it is less than doing the procedure of the endo, as regards time. But we need to be fair to ourselves and to our patient and give him the choice. And our recommendation is this, and then he takes his own decision after we guide him. This is by the law, we need to do that.
Yeah, absolutely. Well, no, it's been great. You're a very passionate guy. I love your history, you know, everything you know, and I love the way that you're sharing it with the students there at Loma Linda, which is a great school, and my daughter graduated from there. Any last words, anything that you'd like to share?
My advice for everybody, for my colleagues and for the new dentists, the new generations, is that take your time in learning. Take your time in taking new technology, new procedures. At this time, your hard drive is still intact. You can take everything. Don't go wild to make money. Money is coming, don't argue about it. It's coming. The problem is that you need to be skillful and take your time in your learning curve and get more technology, more procedures. And trust me, you will not regret it. Everything will be perfect in a certain time, but you need to make the foundation for yourself so that you can accept the new technology and it will be reflected on your procedures and your work, and you will not regret. Don't go for money only, especially at the beginning. You need to increase your skills, your learning curve, and trust me, everything will be fine. Give it its time. That's my advice.
No, that's great. No, you know, I really thank you for sharing, you know, the insights that you have on both the profession, implantology, how we need to treat the patients, respect the bone, respect the tissue, all very good. And I think those of you watching can take some very valuable points home and or take away from the program. And I think hopefully if there are those young dentists that you take these words and kind of really set them in the foundation of your career, because if you do it right, like you said, you won't have to worry about things. But if you try to take too many shortcuts, that's when we end up in trouble, whether we're doing a filling or creating our career.
Oh,
so
yes.
all very good. That was a great interview. I really appreciate that. And you know, one of the things I want to add is that the group down here in Southern California, they're going to be using you, I think, as a kind of a resource, doing some evening programs. And so if any of those of you watching this program would like to learn more or share in some of this passion and the sharing, please keep in touch because there's going to be more involvement, and I look forward to that. It's going to be very, very nice.
Thank you, sir. Thank you very much.
So Dr. Elsherif, great job. As we wrap this up, just want to point out that doing these types of programs is a way for us to communicate and share. Is kind of what's been the theme of this program. We invite you to send your suggestions, whether it be on how to do things better or on topics that you might want to learn about. And unfortunately, today as we're taping this, we're still in this COVID pandemic, and so sometimes we kind of gravitate towards that. But I think what I like to stress is that we should all, as colleagues, help each other out, share with each other, and support each other during this time. And I think plan for that post-COVID practice where we'll be doing a lot more implants and maybe some root canals because patients may be putting off some treatment. So we covered a lot of that today. But I really want to thank everybody, and we wish you all the very best. And let's just support each other. It's this small universe of our colleagues that are watching this, I think, are very important to us. So whatever you need, please reach out to us. And Dr. Elsherif, thank you very much. It's been
thank you,
great
sir. Appreciate that. Appreciate, and I'm happy. And if anybody needs any help, sometimes I get calls from even some of my students, even in other states.
Really?
And we share Facebook, and they open their computers. And sometimes, if I can be of help to anybody, just give me a call. Sometimes I'll not be available directly, but whenever I'm ready, I will call and answer your questions anytime.
Yeah, very much appreciated.
Thank you, sir.
True passion. That's good.
Thank you, sir.
A true professional. So we need more doctors like you, and yeah, so I think that's a sincere offer. And if you need anything, please contact any of us. We'd be glad to be of assistance in any way we could. So with that, just want to say thank you very much for watching the program. Be safe and stay healthy. Thank you.
Thank you very much.
Great job.
The Doctors of Minimally Invasive Implantology series is produced at AMII Studio, located in Fullerton, California. Thank you for watching. If you're placing dental implants, or you're interested in learning more about the most advanced minimally invasive implant techniques, please call Mark Garabedian at 949-338-1460 or email him at mark@amiiteam.org.